So in this video, I'm going to answer the question, what is a role question and how do I answer one? And also the question, what is an opinion question and how do I answer one? Hello, in this video series I aim to provide you with an updated version of the key concepts that you need to know so that you can easily master and be successful in a medical or doctor job interview. Hi there, I'm Dr. Anthony Llewellyn, the career doctor, and I'm an experienced medical HR expert and interview coach. So role and opinion questions are similar questions that are a bit less frequent than some of the other questions we've covered so far in the video series, but these questions still do occur fairly regularly, particularly in more senior medical job interviews such as for trainee and consultant positions. A role question will ask you what you think your role is in a topical area. Usually this topical area relates to the job description. An opinion question is a little bit broader. In these questions, they're generally asking your opinion on a topical area in medicine, usually related to the specialty field that you are working in. Now, it's more easy to predict roles questions than opinion questions. Role questions will, as I say, be highlighted in the job description. So if you've reviewed this thoroughly, you should be reasonably prepared for that. Common role questions are things like, what do you think your role as the RMO is in documentation? Or what do you think your role as the registrar is in team performance? Or what do you think your role as the consultant is in clinical governance? Whereas opinion questions are a little bit harder to predict. They'll usually be around hot topic areas. So for example, in late 2022, which is when I am recording this video, some of the topical issues relating to medicine in Australia include our reconciliation with Indigenous people, taking action on climate change, and the impact of the recent Roe versus Wade decision in the US on local attitudes to women's health. So, whether confronted by a role or an opinion question, the key is to be able to easily provide a broad range of talking points that show you either understand the role or have considered the topic. There are two frameworks that I use with my coaching clients to help answer these sorts of questions. So I'm going to run you through each of these. The first one I call micro to macro. It's a really good one for roles. Basically what you do is work your way up through individual responsibilities, your responsibilities as part of a team, and then broader responsibilities at the hospital level or wider if you have wider responsibilities. So for example, if you're asked what your role is in clinical governance as a consultant, you can answer by saying something like this. At an individual level, I practice evidence-based medicine and report incidents that occur. At a team level, I encourage my team to communicate effectively, document and hand over well, make sure they follow key protocols, and that we review incidents in our monthly morbidity and mortality meeting. At a hospital level, I participate in various formal clinical governance activities, such as sitting on committees, reviewing policies, and serving on critical incident review teams. So that's micro to macro. The other framework that I particularly like for opinion questions is CanMEDS. If you're not familiar with CanMEDS, I will leave a link to it here and in the description, but it's basically a mechanism for visualizing and understanding the key competencies that make up a good clinician. If you're a member of a specialty college, then chances are they have adopted a version of CanMEDS for your college. If so, feel free to use this framework instead. So all you need to do with CanMEDS is pick some of the competencies. I would say at least 3 and talk about their relevance to the topic. So if, for example, the topical area is what should we as specialists in insert whatever specialty in medicine you're in be doing about climate change? And then we can pick some CanMEDS competencies. I'm going to pick scholar, collaborator, and leader. So scholar. We should acknowledge the evidence about the harmful effects of climate change, not just on the planet, but the direct impact on human health and well-being, as well as the socio-economic impacts of geopolitical instability due to climate change. Collaborator. We should work together with other colleges and the medical organisations and the broader health community to advocate for change, as well as work within our own organisations to bring about change. Leader. We can show leadership within the community, but we can also show leadership in our hospitals by, for example, advocating for changes that can have a positive impact on greenhouse gases and global warming, such as opting to attend conferences and scientific meetings in a virtual way rather than attending in person. So that's role and opinion questions. Now, if at any point you feel that you've gotten value out of this video or video series and you just want to dive a bit deeper into mastering the doctor job interview process, then I highly recommend my doctor job interview skills course to you. This is where I do a much deeper dive into each of these question types along with other questions and a lot more concepts to help you truly excel in your next medical job interview. If you click on the link in the description or at the end of the video, you can purchase this course for a special discount just for watching the whole way through. And I'll see you in the next and final video lesson.